It's sad to talk about this disaster. But, this is the story of Brazil. Coronavirus. All called now it as COVID-19. But I called it, as the son of devil. That sad news comes in this Black February. February 25th, the first case of COVID-19 in Brazil, which was also the first in South America, was reported by the Health Department of São Paulo. The infected person was a 61-year-old man who had returned from Lombardy, Italy. But he eventually recovered. A second case was confirmed soon after in another person who had recently traveled from Italy. February 28, Brazilian scientists from Adolfo Lutz Institute and the University of São Paulo's Tropical Medicine Institute, part of the Center for Arbovirus Discovery, Diagnostics, Genomics and Epidemiology, announced they had sequenced the COVID-19 genomes from the first two cases reported in Brazil. The sequencing had been completed in a record time of 2 days and was released on the Wordwide database. The information was expected to assist in improving the diagnosis and control measures to curb the spread of the disease. The analysis showed that the virus had been separately introduced from northern Italy to Brazil on 2 occasions. This has direct implications for understanding the outbreak in Italy. That sad news were further spreading in March too. March 6, Brazilian scientists announced the laboratory cultivation of coronavirus. The intent was to help diagnose and vaccinate against the disease. March 12, Fabio Wajngarten, press secretary to President Jair Bolsonaro, tested positive for COVID-19. The health of the president and his cabinet was monitored due to their recent exposure to the infected man. Wajngarten had also interacted with U.S. President Donald Trump and Vice President Mike Pence during Bolsonaro's visit to Miami on March 7. The Ministry of Health requested an additional Brazilian real 10 billion, $2.1 billion, in the federal budget to fight the disease in Brazil. It estimated that 2,000 intensive care units would be immediately needed. The cruise ship Silver Shadow arrived from the Bahamas and docked in Recife, Pernambuco, bearing 318 passengers and 291 crew members, including one suspected case of COVID-19. The ship was isolated by health authorities. March 13, President Jair Bolsonaro tested negative for COVID-19. The Ministry of Health issued a warning recommending Brazilians and foreigners arriving in Brazil to stay in isolation for at least 7 days. March 17, Brazil's first coronavirus-related death was confirmed. At this time, there were 291 confirmed cases in the country. The state of Santa Catarina declared a state of emergency. As preventive measures, it closed non-essential shops and services, shopping malls, gyms, restaurants, hotels, and suspended public transit, intercity and interstate buses, public meetings, concerts, theaters, sport events, and religious services. March 20, state health departments reported almost 1,000 confirmed cases across 23 of 26 states and also in the Federal District. March 21, the state of São Paulo declared a statewide quarantine. All commerce and non-essential services were to close 24 March 7 April. The quarantine was later extended. All Brazilian states had reported at least one confirmed case of COVID-19, with the most recent being Roraima. March 26, a month after the first confirmed case on February 26, the Ministry of Health reported that Brazil had 2,915 confirmed cases and 77 deaths. March 28, the Ministry of Health reported that Brazil had 3,904 confirmed cases and 114 deaths, suggesting a mortality of 2.9%. Approximately 90% of deaths were people over 60 years of age, and most were men. In 84% of deaths, patients had at least one risk factor, most commonly heart disease, followed by diabetes and pneumopathy. March 31, the U.S. federal government donated 2 million doses hydroxychloroquine to Brazil, for prophylactic and therapeutic use. It touches the April with the weight from March. Again and again, sad and unfortunate. April 6, President Jair Bolsonaro threatened to fire the Minister of Health, Luiz Henrique Mandetta, after they clashed. Following criticism, Bolsonaro temporarily backed down. April 9, the federal government sent out its first financial assistance to the public. Over 2.5 million people received $600,116. April 10, Brazil confirmed the 1,000th coronavirus-related death, as the number of confirmed cases neared 20,000. The virus had reached remote locations. A Yanomami teen died of it in Roraima. April 14, the Ministry of Health reported a total of 25,262 confirmed cases and 1,532 confirmed deaths. Over 14,000 people were declared recovered, although they were not confirmed virus-free, only that they were discharged from a hospital or were asymptomatic. April 16, President Bolsonaro fired the Minister of Health, Luiz Henrique Mandetta, over disagreements about social distancing guidelines. He said he would appoint a health minister who favored reopening businesses as quickly as possible. Shortly afterwards, Nelson Teich was appointed to replace him. April 20, several cities started to ease social isolation guidelines in favor of contact tracing. Some retail stores were allowed to open as long as customers wore masks, the number of in-person customers was reduced, and customer personal information was tracked. Citation needed. April 24, Brazil confirmed more than 50,000 cases. April 30, Brazil overtook China in number of confirmed cases, surpassing 87,000. The numbers are getting higher and higher in the month. May 2. May 3, Brazil confirmed more than 100,000 cases, the number of cases had doubled in less than 10 days. May 7, several cities in the northern states of Amazonas and Pará begun issuing lockdown measures in order to curb the spread of the virus. Other cities in other states consider doing the same. May 9, Brazil confirmed more than 10,000 deaths, the number of deaths doubled in less than 2 weeks. May 14, Brazil confirmed more than 200,000 cases, the number of cases had doubled in 11 days. The state of Ceará became the second most state in confirmed numbers, overtaking Rio de Janeiro. May 15, Brazil's Minister of Health, Nelson Teich, resigns less than a month after being nominated. He cited similar reasons to his predecessor, his clashes with the president over the use of hydroxychloroquine, the social distancing guidelines, and being overruled on rules he was supposed to define. General Eduardo Pazuello assumed the role of interim Minister of Health, until an official replacement can be found. May 26, Reuters reported that according to 4 officials, the Ministry of Health's initial March 13 response to the pandemic was halted and scaled back by President Bolsonaro less than a day later, with power transferred on March 16 from the ministry to the office of General Walter Souza Braga Neto, the cabinet chief of staff. May 31, Brazil confirmed more than 500,000 cases, the number of cases had doubled in less than 14 days. In June, now it is in critical stage. June 1, Brazil confirmed more than 30,000 deaths. June 5, Brazilian government shuts down official website with COVID-19 daily reports, and will no longer report total number of deaths and active cases. June 6, Carlos Wizard, new Secretary of Science and Technology of the Ministry of Health, claims states are overinflating the number of COVID-19 deaths in Brazil as a budget diversion scheme, and calls to recount the total number of deaths. June 7, the government decided that it will no longer publish cumulative COVID-19 numbers, claiming that former numbers may have been misleading. The Health Ministry is to publish only the numbers of new cases and deaths in the past 24 hours. In response, large media groups in the country established a council to keep recording and publishing data according to the original method, amid claims that the government's initiative could be a maneuver to mislead the population instead. As I said earlier, I said this disaster as the son of devil. So my wish is to disappear this disaster from the world soon. God bless you. Thank you for watching this video. Subscribe us for more videos. I wish that, the next video will be, from a COVID-free world.